You ever see something get hit hard? I mean, really hard, like a huge challenge.
Yeah, like a massive shock just comes out of nowhere.
Exactly. And somehow the system or whatever it is doesn't just survive. It kind of bounces back, maybe even changes for the better.
It's that idea of resilience,
Yeah.
right? Not just strength, but adaptation. It's fascinating.
Well, that's exactly what we're digging into today. We're doing a deep dive specifically into health systems.
hmm Trying to unpack what makes them genuinely resilient. And we're looking at this really insightful academic paper.
Right, a paper that studied how health systems across the globe handled some truly massive shocks. Think Ebola, financial crises.
Yeah, climate disasters, the refugee crisis, real-world tests. The paper puts forward this framework, identifies 5 sort of key dimensions for how systems absorb these shocks, adapt, and maybe even transform.
Okay, so it's not just about being tough, it's about changing. So what's this framework? The paper called it 3+2, right?
Yeah.
Sounds intriguing.
Exactly. It's quite elegant, actually. Let's start with the 3 core functions. And the first one, maybe surprisingly, is health information systems.
Information? You'd think that'd be fundamental.
You would. But the paper shows it often failed pretty badly in crises. It wasn't just about lacking data. It was fragmented.
Fragmented how?
Well, during Ebola, for example, staff were so swamped they couldn't prioritize data collection. So you had the military setting up their own parallel systems.
Oh, wow. So not exactly coordinated then.
Not at all. Undermine the response. And look at the financial crisis. Health data lagged way behind the economic data people were using to make decisions.
So the decisions impacting health weren't based on timely health info.
Pretty much. The takeaway is clear. You need robust, integrated information systems before the crisis hits. Trust in data across sectors is key.
That makes sense.
Yeah.
But, even with perfect information, if the money isn't there. Yeah.
Yes, the second core function, funding and financing mechanisms. And this is often the Achilles heel.
I can imagine. What did the paper find?
Well, things like national reserves, financial buffers. They're crucial, but often just weren't there. So who pays?
The individuals, right? Out-of-pocket costs go up.
Exactly. We saw that starkly in Greece and Latvia during the financial crisis. Access got worse. And internationally, like with Ebola, you had this flood of funding.
Which sounds good.
Yes and no. It brought resources, sure, but also huge challenges. Payments to national staff got delayed. And there were even these perceptions around Ebola money.
What? Like created weird incentives?
Yeah, sometimes distorting priorities because the financial systems couldn't handle the influx properly. It's complex.
Wow. Okay, information funding. What's the third core piece?
The people, the health workforce, they're the first responders, always.
Right on the front lines,
Yeah.
but vulnerable themselves.
Incredibly, the paper highlights this. Remember, something like 12% of Ebola infections by mid-2014 were health workers.
That's staggering.
It is. And the response was, well, patchy. Public sector workers often lack supplies. NGOs were adaptable, but sometimes hit walls with, say, insurance or specific technical skills, even with donor cash.
And private providers?
The bigger private hospitals often just closed shop.
Yeah.
Smaller, informal ones kept going, but coordinating them. Really tough. It just screams for better long-term planning and collaboration for these vital people.
Okay, so those are the 3 core pillars. Info, funding, workforce. But you said 3+2, what are the other 2? The cross-cutting ones.
Right. These kind of weave through everything else. First is governance.
The management and decision-making. Often overlooked.
Hugely. But so vital. The paper points out this tendency, especially in crises like Ebola, towards top-down, almost military-style command.
Efficient, maybe, for getting stuff distributed.
Potentially, yeah. But it often shut out local knowledge and input. Plus, it highlighted fragmentation between sectors. Health wasn't properly linked up with, say, economic planning or climate agencies.
So decisions were made in silos.
Often, yes. Good governance and the trust that comes with it are foundational. They shape how the whole system even perceives the shock, let alone responds.
And the final piece, the +2 part.
This one's maybe the deepest. Values, the underlying beliefs and principles.
How do values play into something like Ebola response or a financial crash?
Profoundly, actually. The paper gives examples. During the financial crisis, you saw economic priorities often overshadowing clear health impacts, like rising suicide rates, not triggering major health actions.
So economic values trumped health values in a way.
It seemed that way sometimes. Or during Ebola, you had tensions between global humanitarian ideals and specific local moral codes or beliefs, trust in health workers, in institutions. It's built on shared values.
And sometimes individual values shine through.
Absolutely, like doctors or nurses treating undocumented migrants even when policy excludes them. Compassion overriding the rules. It shows how deep these values run.
So this whole framework, information, funding, workforce shaped by governance and values, it paints a really comprehensive picture of resilience.
It really does. It boils down to that 3+2. Robust functions guided by effective oversight and shared principles.
So taking all this in, this deep dive into how huge health systems cope, what does it maybe teach you, listening right now, about handling your own shocks, big or small?
Exactly. Context always matters, of course. But learning from these massive events gives us really valuable insights that apply more broadly.
And that idea you mentioned earlier, that shocks aren't just bad.
Right. That's key. Shocks can be these unexpected openings for real transformative change, pushing systems or maybe even us towards a different, maybe better state.
Which leaves us with a thought, doesn't it? How could you apply these lessons needing clear info, stable resources, a supported team, good governance, core values to the curveballs in your own life, or even in the teams or communities you're part of? Could that next challenge, that unexpected shock, actually be a catalyst for your own transformation?